As a dentist, I've always been interested in anything I can do to improve aesthetics. Injectables can be applied in dentistry both therapeutically as well as cosmetically. So therapeutically, we can actually inject into big muscles like the ones that actually cause grinding and clenching, as well as if there's an asymmetry in the face, we can soften that as well. Then we can also apply them cosmetically, which is great. So we can reduce gummy smiles, we can reduce crow's feet, frown lines, all of those sorts of things. There are two types of injectables. One is muscle relaxants, designed to relax the muscles. And the reason we do that is because if we have relaxed muscles, then the skin doesn't compress and contract over the top of the muscles as frequently. The second facial injectable is actually hyaluronic acid or dermal fillers. These are temporary in nature, and the idea is they restore volume loss. They can also improve structural issues like cheeks that might have sunken down a little bit, a chin that might need a little bit of lengthening as well. So generally with muscle relaxants, it takes about 2 days to 2 weeks before you actually get an effect. With dermal fillers, it's an instant effect. However, you will get a little bit of swelling and possibly a bit of inflammation, which takes about a week to settle down. And then you'll find it will actually last anywhere from 6 months to 18 months, depending on the area. So the main areas we'd use muscle relaxant on include crow's feet, frown lines, any static lines that are on the forehead, gummy smiles, obviously. We also inject along the jawline to reduce the pull down. So naturally the face tends to go downwards a little bit with age. Dermal fillers are wonderful for giving your lips a little bit more volume, restoring the actual structure of your cheek and your chin, and also just for filling in some deep lines or deficits in the face. If you're looking to obtain some injectables, we first of all give you a consultation whereby we do some facial mapping. Then if you decide and are a good candidate for injectables, we'll actually take about 10 minutes, sometimes just a little bit longer, to actually give you the injections and to talk you through it. Dentists are highly trained in facial anatomy. We watch faces all day long and we know how things work. We know what makes you smile and we know what makes you frown. We know what makes you clench your teeth. So in this wonderful sterile environment, it's an extremely safe place to go.